Hi everyone, my name is Rebecca Decker and I'm a nurse with my PhD and the founder of Evidence-Based Birth. In this video, we're going to talk about the effects of epidurals on the pushing phase of labor. In past videos, we talked about the benefits and risks of epidurals, and we also talked about potential effects of high-dose epidurals on breastfeeding. In this video, we're going to focus in on the effects of the epidural on the second stage of labor. The second stage of labor begins when the cervix is fully dilated, includes the pushing phase, and ends when the baby is born. This is an important topic about the length of the second stage of labor, because longer second stages have been linked with worse health outcomes for the mother, including a higher risk of infection, a higher risk of having a severe tear, a higher risk of postpartum hemorrhage, and higher risk of needing a forceps, vacuum, or cesarean. Researchers have suggested that epidurals could potentially decrease the mother's pushing efforts, reduce the effectiveness of the uterine contractions during the pushing phase, and possibly even relax the pelvic floor, which would affect the baby as it is rotating and coming out. A large body of research evidence has shown that epidurals are linked to a longer second stage of labor. This has been demonstrated in large observational studies as well as in randomized controlled trials. One large study was led by Zhang and was published in 2010. These researchers looked at more than 62,000 people that gave birth across the United States. About 80% of the people in this study had an epidural. They found that the average length of the second stage of labor was 1 hour and 6 minutes for first-time mothers with an epidural and 36 minutes for first-time mothers without an epidural. People who had given birth before, and this was a subsequent vaginal birth, had faster second stages than the first-time moms. If you'd given birth vaginally before and you were in this study, you spent an average of about 30 minutes pushing with epidural and 15 minutes pushing if you did not have an epidural. Another study looked at 42,000 people giving birth in California. When they looked at first-time mothers who were giving birth with an epidural, about half of them gave birth within 2 hours, and then the other half took longer. When they looked at first-time mothers giving birth without an epidural, about half of them had given birth within 47 minutes, and the other half took longer. In other words, epidural use added about 73 minutes to the second stage of labor for these first-time moms. We can also look at the Cochrane review of more than 38 randomized controlled trials that had nearly 10,000 participants total. They found that second stages of labor were on average about 14 minutes longer with an epidural. Recently, there's been a lot of news headlines all about a new study that came out claiming that epidurals do not lengthen the second stage of labor. And I had a lot of people reach out to me with questions about that study and concerns. What does this mean? For example, an article in the Huffington Post had the headline that said, "Epidurals don't necessarily slow labor, study finds." Well, the study that they were talking about took place in China in the year 2015 and was published in 2017 in the Journal of Obstetrics and Gynecology. People in the study were first-time mothers giving birth at term to a single baby. They all went into labor spontaneously and they all requested epidurals. Everyone received a very low dose of medication in their epidurals. So these are considered what we call low-dose epidurals. At the start of the pushing phase of labor, so they'd already been receiving the epidural all the way through the first part of labor, at the start of the second stage, 178 mothers were randomly assigned to receive saline or saltwater placebo through their epidural. And 171 mothers were randomly assigned to continue receiving the epidural solution with epidural medications. Both the patients and the care providers were blinded, so they didn't know what type of solution the mothers were receiving. They found that the length of the pushing phase was similar in both groups. It was about, on average, 51 to 52 minutes of pushing. Also, rates of vaginal birth were similar between the two groups, about 97 to 99%. It's also interesting to note that the pain scores were similar between the two groups. What this means is that both groups were still being affected by the epidural medications they'd received during the first stage of labor. Ropivacaine is the drug that they had been receiving all throughout the first stage. This is a long-acting drug that lasts about on average 4 hours in your body. So even though they had turned the epidural off for half of the people in the study, the medications were still in their system. So this particular study was not comparing epidural versus no epidural. It was looking at the effects of turning off the epidural during the second stage. And basically they found that because the medications remain in the mother's body, turning off the epidural in the second stage probably doesn't have any effect on the length of the second stage. So I just want to encourage you to be wary of news headlines that say things like, "New study proves." It's important to consider the overall body of evidence. What has all the research shown up until this point? And it's also important, if you can, to find that study for yourself and look at it, or ask somebody else to look at it with you, like a trusted healthcare provider. You need to look at the methods of how they actually carried out the study, including the limitations of the study. A lot of people were tricked by these headlines because they thought it meant that epidurals don't lengthen the second stage, when that's not what the study was looking at all, and it's actually not what they found. So I hope this was helpful for you, and hopefully it was a good lesson in making sure you look at the details of the studies before you take their summaries to heart. That's it for this video. Thanks and bye.
To learn more and subscribe to our newsletters for useful information, please visit evidencebasedbirth.com.